Can high CRP levels predict a rheumatoid arthritis flare? Imagine trying to predict a storm before it hits. In rheumatoid arthritis, doctors look for signs that inflammation is rising, and one of those signs is a blood test measuring C-reactive protein, or CRP. CRP is a protein made by the liver when your body is inflamed. When rheumatoid arthritis flares up, inflammation in the joints increases, and CRP levels often go up too. So, high CRP can sometimes hint that a flare is on the way or happening. But it's not that simple. While a sudden rise in CRP can suggest increased inflammation, it's not a guaranteed sign of a flare. Some people with active rheumatoid arthritis may have normal or only slightly elevated CRP levels. This is because inflammation in rheumatoid arthritis can vary from person to person. Some patients have joint symptoms without a corresponding increase in CRP, which means relying only on this marker might miss some flares. Doctors usually monitor CRP over time to understand each person's baseline. If CRP suddenly jumps above that baseline, it might be a warning sign that inflammation is worsening. However, because CRP can be influenced by other factors like infections or other health conditions, it's important to interpret it alongside other signs. For example, joint swelling, pain, stiffness, and patient-reported symptoms are crucial clues. Imaging tests like ultrasound can also detect inflammation even if CRP levels are low. Researchers are exploring additional tools to better predict flares. Blood tests that measure other markers, combined with clinical assessments and imaging, give a fuller picture of disease activity. For instance, the disease activity score that includes CRP, called DAS28-CRP, helps doctors evaluate how active the disease is overall. In practical terms, regular CRP testing can help track trends over time. A rising CRP might prompt a doctor to review treatment plans before symptoms worsen. But it's important to remember that CRP is just one piece of the puzzle. To effectively manage rheumatoid arthritis flares, healthcare providers combine blood tests, physical exams, imaging, and patient feedback. If you notice increased joint pain, stiffness, or swelling, it's always best to consult your healthcare provider. They can interpret your CRP levels in context and decide if your treatment needs adjustment. Remember, every person's experience with rheumatoid arthritis is unique, so personalized care is key to controlling flares and preventing joint damage.